It's working.
Asante sana. Thank you very much. I want to take this special moment and in a very special way welcome our Cabinet Secretary for Health, Honorable Kagwe. He has made a tour of the county. He is very familiar with the state of the health in this county. Today he has toured JM Karaoke Memorial Hospital. He has visited the isolation ward and all the institutions of the hospital, and I'm sure we have given him the challenges that we are going through, and I want to assure you that this is a very lucky day for Nyandarua County. He will be telling us how we are going to partner together and move forward our agenda together. But before I continue, I want to invite the Senator to say something, and then I'll conclude and invite the Minister to say something. Just a minute, Senator, Honorable Senator. Can you use this?
Yeah, thank you very much, Governor. Watu wa Nyandarua hamjambo. Hamjambo tena. Yeah, we are here. We've been going around the hospital to see the facilities that are available for the COVID-19 pandemic. And I can tell you, the hospital is getting ready for each and every person who may be affected by the COVID-19. I thank the governor for what he has done. He has put a lot of effort, and I think sooner than later we'll be ready for this pandemic. I'll not want to talk more than that. Thank you very much.
Asante sana. So before I invite the Waziri, I want to again welcome you, Waziri, to Nyandarua County. And you can see wananchi wa Nyandarua wanafurahi sana kukualika hapa. Hii ni county ambayo imekuwa ikiongoza kwa mambo mengi. Tumeona tayari tumekuonyesha machineries ambazo tumenunua kupitia jitihada za county yetu, 721 million shillings ambazo zimeingia katika county yetu. And of course Nyandarua County was ranked the most productive county, the best county to invest in, one of the fastest growing counties. Lakini shida ya health vile umeona, these are best institution katika county yetu ya Nyandarua. So you can imagine how the others are. We have major problems about tungependa kusaidiana na wewe. The issues of asbestos on our roofs, the congestion in the hospital, the inadequacy of staffing, technical staff, and also equipment that we have, and the issues that we have agreed with you that we could work on, especially on the shortage in the labs. So I've hosted today Cabinet Secretary Honorable Kagwe to evaluate the level of preparedness in dealing with the novel coronavirus pandemic. I've taken him a tour of JM Hospital. I'm glad that Honorable Kagwe witnessed our dedicated personnel in action in this facility. We're eternally grateful to each and every one of our health workers who are here, and I want to assure you we have very, very dedicated health staff personnel in this county, in this hospital, and in the other hospitals in the county, and they're all in a state of preparedness. And before I even proceed, wananchi wa Nyandarua County, hivi leo tumepata PPEs. Mnajua PPEs vile ziko bei kali, tumepata 1000 units of PPEs. Tupigie waziri wetu makofi ambazo amelete, na bado ametu promise ya kwamba atalete vitu mingi zaidi. 1000 PPEs have already been donated in this hospital. They are already here. We shall distribute them amongst areas where we have the threat of coronavirus. You may be aware Nyandarua County is blessed. We have many scenic issues. I don't want to dwell on those. But we are one of the most progressive counties. We produce food for the country, and therefore maintaining the health of these people is of utmost importance. Some of our key challenges include kidney challenges, heart challenges, hypertension, diabetes, because of the state of our food in this county. And we would like to partner with your ministry. We would like to partner with you and make sure that you support us, Waziri, with the challenges that we are going through. I also want to appreciate, wananchi wetu, would like to appreciate the fact that Waziri Mutahi Kagwe, kuna mashikaria mingi hapo. Azimwambia azime if it can't work. Okay, can you switch it off? You can switch it off. Hii nafikiri tunasikika kwa hii. nafikiri wananchi wetu tunasema ni bahati kubwa sana na ni baraka kubwa sana ya kwamba iko makele mingi hapo. Niseme ya kwamba ni sisi tunasema waziri wetu Mheshimiwa Motai, tunasema ni Mungu amekuonekania kwamba wakati umeingia katika hii wizara ya health, huu ugonjwa wa COVID ukaingia, ukaanza kuingilia wananchi wetu. The efforts you have put with the president, nikipenda kusema we appreciate you with the president 100%. The regulations you have given, the framework you have given us, the principles you have given us to follow in terms of managing the COVID-19 and also other health issues in this country. We would say it is God-given that you came in at the best time to be able to support this country, to be able to manage the COVID-19. I don't know where it would have been. The efforts the president has put in, the efforts you have put in as a minister, I want to assure you, Kenyans are very, very proud of you. The efforts you have put in to secure the country from the scourge of the COVID-19. Tupigie waziri wetu makofi, wananchi wetu, kazi mzuri ambayo amefanya. Would like to request some of the issues, very few requests, because I want to be very brief. Security of specialists, internal medicines consultants, general surgery consultants, pediatrics consultants, pathologists, radiologists, to enable JM Kariuki facility to become a teaching and referral hospital. We have already requested that you help us, we work with you to make sure that JM becomes a level 6 referral hospital, so that we can be able to take charge of the many challenges that are facing this county, this area. We have already put in ourselves as a county, Kama governor, ourselves, we are putting 300 million shillings from next year to make sure that this institution starts to evolve as a level 6 hospital, because even though we are told we are level 4, we are actually level 3.5. I was telling Waziri we are level 3.5. We need to be supported to actually become level 4, ultimately move to level 6. At the Faro Hospital, we have an MTC here that we would like to request you to support us so that we're able to move ahead. We have given you a budget. We have given a budget of 1.2 billion shillings that can progressively, in 2 years, be able to transform this county to be able to achieve the challenges that we overcome the challenges that we are facing. We have requested for Kemri facility to be put in this county so that we can be able to move ahead. We have requested for 300 acres to be carved out of the Karo land so that we can be able to bring in Kemri in this county, and also other research institutions in this county. The issue of human capacity for the health sector, we have agreed with Waziri that a special team is going to work to develop a strategy to bring in staff, to bring in infrastructure, to bring in equipment. I'm sure, because Waziri Mutai and Waziri Matiang have specifically been sent by the President to see how we can support, how the President can support this county, and we want to appreciate when you go back, Mwambie Rais, we are very grateful that we was able to send you with Waziri Matiang, and we have discussed in the office, that's why I'm summarizing, and they have agreed that they are going to support Nyandarua County. To Apige Makofi, they are going to support Nyandarua County in very, very major ways. In terms of equipment, you have seen equipment is already coming. In terms of quarantining and isolation centers, we have already worked out as a county. We are already working on 300 beds for isolation, and we have more than 10,000 beds for quarantining. If that came, we have identified several education institutions where we can be able to put in our people. We have already put in 240 million shillings as a county to fight this COVID menace. We have already put in 33 million shillings to buy food for people who are very hungry. And Waziri here, plus Waziri Matiang, they have agreed they will support us with food to be able to cater for those who are very hungry in this county. Although we are food basket county, we have people who are very hungry and who cannot be able to afford to put food on the table. So there are many other things that we have done. Waziri, I don't want to go. We have fumigating our markets. We are cleaning our centers. We have almost 7,750 water tanks with sanitization facilities that we have already been able to, that we have put in place. Disinfection and provision of hand washing facilities, cleanup of urban centers, screening at every entry point in the county where temperature checks are undertaken. 600,000 people have been screened, and thank God none of them has tested positive. Tunashukuru Mungu ya kwamba tumekuwa safe, but we want to keep on taking care, keep on washing our hands, keeping social distance, wearing masks, staying at home as much as possible, keeping children at home, and that has been very. We have also availed numerous tax breaks, and small business and entrepreneurs, they are not paying tax. We have given that redemption until possibly August, and we're also giving water free at a cost of almost 8 million shillings in this county. So as a county, we have done our best. It's been quite expensive, but we said we'd rather take care of our people, because you cannot govern people who are not healthy or people who are not there. That's why we are putting every measure, and I'm prepared to reallocate more money to fight COVID and to ensure that our people are safe and support our president in the initiatives that are ongoing. We are putting a 13-bed ICU facility costing 70 million shillings. It's already, you have seen that as the ICU system. The 300 isolation beds was really, we have JM has 25, ICU, JM hospital, we have another 10. JM hospital dialysis unit, there are 2. JM hospital isolation, 13. Engineer hospital, 3. KMTC school, 110 beds. Gatimo Health Center, 40. Gano Health Center, 50. Engineer hospital, 50. North Kinangop, 7. Totaling 310 isolation bed capacity. That's how we have distributed our facilities. We have Beyond Zero trucks. I'll discuss with you later on how you can support us. We got one from Mrs. Margaret Kenyatta, National First Lady, and we also have one as a county given to my wife to also support this county, and I'll be sharing with you because I want to take very little time. 101 UHC health care workers are already in place. 89 healthcare works have already been put in place. 14 tons already joining us. We have recruited medical staff. Close to 300 staff will be joining us to support this county. 20 schools, 11,000 bed capacity for quarantining. I've mentioned this. County has an active surveillance program that identifies all suspects, case investigation and response, contact tracing within the county. And we have adoption of the time-bound protocols for progressive reopening of economy in 14 days. We already put in a team to work on the protocols so that we can be able to see how we can open up the markets, the supermarkets, the border stages. We are working on these bus stages. The media strategies have also been put in place. The volunteers are already in place, creating information centers, sensitization, use of youth to enhance COVID-19 information dissemination, the health volunteers, and many other programs that I cannot be able to read all of them. I'll share with you this statement, so that you can see what you have done. The churches, we're also going to sit, as you sit in the national, we're also sitting with the churches in the county to see how we can ensure that every congregant is safe, the bishops, the pastors, the priests are safe, and that churches, once it comes to the recommendations of opening up these churches, that we all adhere to a national protocol that you'll be able to guide with the president, and that we shall be able to customize in the county. The donations have been coming, and as I've appealed to you for medical supplies, at least our diabetics have a problem of accessing drugs. The county can spend so much. If you can be able to help us in diabetics, cancer patients, the handicapped people with some of the equipments, have put in 20 million shillings, but this is not enough, and we want to add more. Most of the monies, out of the 240 million, most of the monies are going to preventive services, and I want to appreciate that even those of us who are engaged in prevention, we are also being able to be supported by your ministry, and we want to partner with you on this. I think I should add there so that Waziri can have time to also go into other issues. I want to assure you, Waziri, that we will work together. There are many things I've not read in this statement. I'll share it with you. Again, we want to assure you that Nyandarua stands with you and the president in the fight against COVID. As we reopen the economy, we'll look at the pros and cons. Where we think is risky, I think also the county-specific initiatives will be put in place so that we can all move as a country and save our people and secure our institutions, but also fundamentally secure the economy of this country. Thank you very much, and God bless you. Sasa nataka tumkaribishe waziri wetu. Nimesema kwa mimi najua Nyandarua mnaelewa Kiingereza, hakuna haja ya kurudia tena kwa sababu najua mmeelewa, lakini kwa ufupi waziri amekubali na ametumwa na rais wakiwa na mheshimiwa Matiang'i, wamekubali ya kwamba ile mambo yote ambao tumeuliza watusaidie kufanya hii hospitali level 6, kufanya engineer level 5, kutusaidia health centers zetu ziweze kuamuka kuwa level 3, level 4. Tumekubaliana na waziri, tutakaa chini na kamati yake na atatusaidia. Na mimi najua huyu waziri tumefanya kazi na yeye, tukua serikalini ya mzee Kibaki na pia serikali ya Rais Uhuru. Ni mtu ya vitendo, na vile mnaona sio mtu ya kurudi nyuma. Mundu wako kwa kana guthi yake mago ni mundu wa cieko mola iro gado iko. Kogwo ithiwe na support itwandwa Nyandarua, ndukagie na wasiwasi. Ugenda kujita na thaa thita cio tuko jitatu ko twi hamwe turute wira tukoretwo kuruta thini wa thirikari tukuonia bũrũri witũ atĩ no tũnyitĩre bũrũri witũ ko imara. Ũgũrũkire wako ministry yo nĩ Ngai ũrakũreire hau, wahonokia mĩoyo ya andũ aitũ, wateithia rais kuruta wĩra mwega na tũreyũragia kũngĩathire atĩa no tondũ wĩ hau na Ngai nĩ akũrehire hau Ngai akũrathime ũkĩgitĩra andũ a Kenya ona wĩ na family yaku Ngai akũgitĩre. Asante sana, tumpigie makofi ya kumkaribisha. Asante sana, thank you very much and God bless you. Asante.
Asante sana Governor. Andũ a Nyandarua mũrĩega rĩngĩ mũrĩ akenu nĩ gũka gwitũ. Asanteni sana. Kwanza let me just say Wakenya wapendwa, welcome members of the fourth estate. Today's media briefing here in Nyandarua County. Today I am glad to be here in Nyandarua County as part of my official visit to assess the level of preparedness for coronavirus disease. I want to appreciate the warm welcome accorded to me and my entourage from the Ministry of Health by the county government led by Governor Francis Kimemia and the people of Nyandarua County. Governor, we are indeed grateful. Tunashukuru sana na watu wa Nyandarua tunashukuru sana. I'm glad and pleased to note that Nyandarua County is among the 9 out of 47 counties that have so far not recorded any case of coronavirus disease. According to our statistics, having conducted 600 samples from Nyandarua County, and none has tested positive. And for this, I want to congratulate the people of Nyandarua for being COVID-19 free to date. However, this does not mean that the people of Nyandarua are immune from contracting the virus. Far from it. I want to urge the county government and the people of Nyandarua to jealously protect this status that you have. And how can you do this? It's very simple. It is by adherence to the containment measures that have been given by the Ministry of Health. First, I am sure you have been following our daily updates through various media, where we have been educating Kenyans on the containment measures. This includes wearing of masks, and I'm very happy to note that this is one county where I traveled through and you are using masks. Asanteni sana. This might actually explain why Nyandarua remains COVID-free, and we want you to stay that way. Washing of hands, using soap and running water, sanitizing where possible, observing social and physical distancing, avoiding gatherings, limiting or even not allowing visitors to your houses. I am sure there is a Nyumba Kumi initiative here in Nyandarua. Utilize this governance structure to ensure that there are no strangers coming to your villages, coming to your homes, because this is the main way that the virus is transmitted. The virus does not move on its own. It is moved by people. If you see any strangers in your locality, report them to your Nyumba Kumi, the sub-chief, the chiefs, the county government, so that you can remain COVID-free. Therefore, if people of Nyandarua want to maintain a zero infection rate, this is the way to go. Just keep following the same path. Fellow Kenyans, allow me to discuss while here pertinent issues on health and nutrition that affect our people. These issues are very important for sustainable development of our beloved country and very important for us to sustain a symptomatic COVID-free status as we move on. Our Constitution recognizes importance of health and nutrition. As a country, we are currently experiencing triple burden of malnutrition with coexistence of undernutrition, overnutrition, as well as mineral and vitamins deficiencies. As of 2014, 1 in 4 children under the age of 5 years were short for their age. That is called stunted. 4 in 100 children were wasted, which is a sign of acute significant shortage of food or disease, while 1 in every 10 were underweight, meaning that our children were either thin, short for their age. At the same time, 4% of our children are overweight. Ladies and gentlemen, feeding practices, only 22% 23 months consume minimum acceptable diet, while 61% of our children are exclusively breastfed in the first 6 months of life. This calls for enhanced nutrition counseling at household level. Last year, a study conducted by the Ministry of Health on the cause of hunger in revealed that in 2014, the country lost 373 billion shillings, which is about 6.9% of our GDP, due to child undernutrition. This amount is equivalent to the budgetary allocation to all 47 counties as we speak. It is also associated Is it work? Can you hear me? Can you hear me now? Oh, thank you very much. Mwambie hata ikizimika tutaendelea tu. Sivyo? Fellow Kenyans, consumption of a healthy diet is important in promoting physical, mental growth, and development, in addition to building, repairing of tissues and cells damaged by infectious diseases such as COVID-19. This provides energy to work as well as protection from disease and deficiency disorders. Therefore, it is important to consume nutritious and safe food during the current COVID-19 pandemic in order to strengthen the body immune system to not only fight infections, but also speed up recovery when one has got the infection. The Ministry of Health is committed to attaining health and nutrition agenda through the Health Policy 2014-2030. Currently, the Ministry is implementing the universal health coverage. A lot of emphasis is being placed on strengthening the primary health care as it provides the engine for UHC. For this reason, counties are encouraged to establish and operationalize community health units that will deliver health and nutrition messages so as to prevent disease and to promote healthy lifestyles. Prevention is the key. Even though we are building hospitals for cure, but nonetheless, the Ministry of Health is determined that prevention will form a huge part of our operation. I am informed that the Nyandarua County Nutrition Action Plan is under development This is important that we put it and we fast track it, Mr. Governor, so that the full implementation of it will be worked together with your government. The Ministry of Health is prepared and ready to help you achieve this objective which you have. And in any event, Nyandarua is lucky because Nyandarua has got food, even though you have the challenges that you have said, because of the colonial villages and because of certain historical facts. But nonetheless, this is an area with food. So we will support you in ensuring that that happens. You know, as I was traveling around Nyahururu, I would not fail to notice the country's rich agriculture potential that includes your horticulture, we know it, the milk, the maize, the wheat. And then I asked myself, why would 3 in 10 children under the age of 5 in the country as a whole be stunted? And I'm informed that this could be as a result of simply poor infant and child feeding practices. So it is important, ladies and gentlemen and fellow Kenyans, for us to think about how we feed our children in order for them to grow up with sufficient immunity. And because of our immunity, we will be able to protect ourselves against this disease. And turning to our COVID-19 situation, we have today 133 people who have tested positive to the disease, out of a sample of 3,365 persons who we tested over the last 24 hours. This now means that Kenya has 3,727 people who have tested positive to date. And the total number of samples tested is 118,701. We continue to be happy about our discharges. Today, we have discharged 33 more patients from the various health facilities in Kenya, bringing the total number of recoveries to 1,286. Unfortunately, we have lost 1 more patient to the disease, and our sincere condolences go to the bereaved family and friends. As observed, the number of those infected with the virus continues to rise. And as a country, we must take individual responsibility to curtail this. I am glad to note, as I said earlier, that Nyandarua at the moment is COVID-free. And I want to appeal, seriously appeal, to the people of Nyandarua to make sure that this status is what has been maintained. What happens elsewhere is that when you get 1 patient and then another, it grows exponentially. And very soon, you get the kind of cases you are hearing in Nairobi and elsewhere. So I am happy and glad that this is the status that you have. And the reason why I am here today is to urge you to keep it that way. Because if you keep it that way, it means that you'll save money for the county government, you'll save money to the national government, but you also save the families money for medical care. Finally, I want to thank the government of Nyandarua under the leadership of Governor Francis Kimemia, together with all the people of this beautiful county, for your warm hospitality. I also want to commend the dedicated health workers who are here. Mapigieni makofi tafadhali. I want to thank you, health workers. I want to thank you. And as a country, we want to thank you for the continued work that you are doing, the care that you are giving our patients. I have walked around and seen people in the wards, people in the dialysis units, the commitment with which your X-ray people are working. They are always exposed, but they will not give up. And for that, we as a nation are grateful to our health workers. As a ministry, we recognize and appreciate these very important people to us, and we will do everything possible to ensure that we protect you also. And that is why we today came with the PPEs that we brought to ensure that even as you begin to receive cases, we hope not, but if you do, then you are protected. Kwa hivyo, mimi ningetaka tu kuongeza kidogo. Tuko hapa Nyandarua leo tukiwa na rafiki yangu CS Matiang'i ambaye ako pande nyingine ya Nyandarua, ameenda kufungua police stations na kuwa na security meeting kuzungumza mambo ya insecurity ile pengine iko hapa katika Nyandarua. Vile vile tumekuja na salamu kutoka kwa Mheshimiwa Rais Uhuru Kenyatta. Nimwamukira geithicio. Nimwamukira. Goko muri nake kana mutire nake? Muri nake. Bio bio. Mutiragoa. Mutiraina. Asanteni sana. Kwa mimi nataka tu kuongeza ya kwamba kwa sababu Nyandarua haina hii virusi, mimi nataka mjikinge na njia ya juu zaidi kuliko wale ambao virusi imefika. Kwa sababu mkijikinga na muendelee hivyo mlivyo, ni kusema ya kwamba familia yenyewe, wewe ukiwa na familia yako, ni kusema utatumia pesa zako na hii virusi kushunga familia yako, kuwapeleka hospitali. Vile vile utakuwa na hiyo challenge ya kuwa na mgonjwa nyumbani, kwa sababu vile tunataka kupanga sasa katika Wizara ya Afya ni kwamba kuna wengine ambao watakuwa na hii virusi, lakini wakimaliza siku chache, kulingana na vile World Health Organization watatueleza, itafika pahali ambapo serikali yenyewe haiwezi kuwa na nafasi ya kuweka kila mtu. Kwa hivyo itafika nafasi tuanze kuuliza wananchi washunge wale ambao watakuwa na virusi ambao wamepitisha zile siku, ndio sababu hawezi kuangamiza wengine. Kwa hivyo ni vizuri kufikiria hiyo maneno, ndio tuwe watu wa Nyandarua tufikirie sana vile tutajikinga, sana kuendelea na kunawa mikono, kuendelea na kutumia mask, kuendelea na kuweka social distance. Na direda andũ aitũ reke inde mwire utheru nĩguo gũtũteithia utheru. Na nĩ tũrona atĩ nginya ta rĩu kũrĩ andũ aingĩ mũno marakoragwo thibitarĩ magoka nĩ ũndũ wa kũrwara nda, nĩ ũndũ wa kũharwo, no rĩu nĩ tũrona mĩrimũ ĩyo nĩ ikũrũkĩte thĩ tondũ wa andũ gũkorwo nĩ marethamba. Na nĩ njũĩ ona ũngĩũria ndagĩtarĩ nĩ agũkwĩra nĩ ũndũ wa gwĩthamba moko mĩrimũ nĩ ĩrathiĩ nyite kanini. Na ukiangalia hata sokoni vile tunataka kuendelea mbele, hata COVID ikiisha, kuendelea mbele, mambo ya prevention, mambo ya hygiene, ndio tunataka sana kuendelea na hayo. Kwa hivyo kama ni sokoni, ni lazima watu wanafanya sanitizing, ni lazima watu wanaosha mikono. Ukiingia huko ndani, ukienda kwa mama ambao anauza mboga ama kijana ambao anakuuzia makarot, uangalie ya kwamba kama yeye mwenyewe ako na mask, kama anakuambia utumie sanitizer, kwa sababu ukishunga vizuri, ukiangalia vizuri katika soko, ithe muti ura tuthiaga twagithukia kaboga ni muti onaga rĩu tuti ukienda we ugathi ugathukia maembe ukamacokia ukamaigathi uria ũngĩ nake akoya iembe rĩu na wewe na mũrimũ ũcio nake akanyitwo ni mũrimũ ũcio. Kwa hivyo utaniuia radhi wale ambao hawaelewi hiyo lugha, ni kuwa tu niseme, kwa sababu ukitranslate guthukia boga itakuwa ajabu sana. Kana ti watu aitu. Yeah, asanteni sana. Maybe we can take one or two questions. Niko hapa na watu wa madaktari kutoka the Ministry of Health. Niko na hapa Dr. Kuria ambaye ndio mkuu wa Directorate ya Public Health. Kwa hivyo mtu akiwa na swali, hii ni wakati mzuri wa kufanya hivyo. Kano Oguna ambaye ni government spokesman, endelea sasa.
Asante pia. Asante sana waziri, asante sana mheshimiwa governor. Kabla sijapatia nafasi ya kuuliza maswali, mimi nasema pia niko na furaha kubwa kuwa hapa, manake hapa niko nyumbani. Niko nyumbani kwa sababu mimi nimelelewa hapa Rurie tu, ambapo ni jirani kutoka hapa. Kwa hivyo ni asante na furahi kwa sababu nimerudi nyumbani. Kwa maswali sasa nawapatia nafasi waandishi wa habari waulize maswali. Unapopata nafasi ya kuuliza, sema jina lako na idhaa unayowakilisha. Asante. Okay. Who wish to go first?
My name is Alan Ochanda from KTN News. Maybe Waziri, you've talked about the plan to have World Health Organization to lay down the procedure of, for the Ministry of Health to ensure that you now make sure that the persons who are infected with COVID-19 are now isolated in their respective homes. Maybe as we wait for the World Health Organization roadmap, if the counties and the health facilities are now overburdened, what are the short-term plans? And then, Governor, you had actually indicated that we have people who are suffering from non-communicable diseases. And in this county, you're lucky that you have not recorded any COVID case here in Nyandarua County. Maybe, of course, you're not immune as CS has said, but what are your plans? How has your government factored in the persons who are suffering from these non-communicable diseases, who are also highly vulnerable to contracting this dreaded COVID-19 virus?
Yes.
See, and my question is in regards to.
Please speak up.
My name is Sarafina Robi from KBC. The question is in regards to of COVID-19. In the country, since we have ongoing research on COVID-19, have you been able to come across the mutation of the COVID-19 virus, and how lethal is it compared to the dominant strain? My second question is in regard to the ongoing launch of beds and ICU beds that you've seen in different counties. Perhaps have you been able to go back to these counties and ascertain if they're actually there, or if this is just hot air from the counties?
Yes. James Maderi from Inoro FM, and WHO and Ministry of Health have been saying that asymptomatic patients cannot transmit the COVID-19 virus. Does it therefore mean that we have overrated some of the measures like wearing masks, social distance, and lockdowns?
Thank you very much. I don't know. What I'm going to do is I'm going to respond to some of them, and I'm going to ask Dr. Kuria to respond to the issues that you have said. I am not sure that we have said that asymptomatic patients do not transmit, but I would ask maybe the governor can respond to his question first.
Okay, Asante. Thank you very much, Waziri. I think that was a good question, the issue of non-communicable diseases. And as I said, we have very many cases of diabetes here. We had shortages of drugs, which I've already requested Waziri to partner with me to increase the volumes. Watu ambao wako na shida ya sukari wangependa kusaidiwa na zaidi na dawa za sukari. Watu ya cancer ni wengi sana hapa ambao wangependa kusaidiwa na madawa. We are supporting them with drugs and food for the time being with the 240 million budget that we have already allocated in the budget. But that is not enough because these cases are likely to increase. Tuko na PWDs ambao usaurika wakati kama huu ambapo watu hatembei, PWDs in the county, heart diseases, kidney diseases, those ones go together, and also arthritis kwa sababu ya baridi. These are diseases of Nyandarua County that really affect our people. So what we are doing is to look into our budget, allocate some money, support them in terms of what Waziri said, the issues of nutrition. We provide free milk to our children in ECD. We want to start giving them even as they're at home, because of some areas are you find 29% stunted growth in some parts of this county, particularly in Nyandarua area. So we would like to Waziri to partner with you on that issue of nutrition that we have suggested, that we work together and see how we can support this county. But on those people who are really in very difficult circumstances, the ones that have those non-communicable diseases, the county we have already allocated resources to support them. We may not reach all of them, but some of them we want to give them cash stipends from this money to be able to buy, particularly cancer patients and the diabetics, to buy what they think is supposed to be bought in terms of their feeding, because they cannot feed from the normal supplies that we give to the normal people in the county. Thank you.
I think the other issue that perhaps also to add to what the governor has said has to do with the hospital readiness to deal with those diseases. As you know that this hospital, JM, is a beneficiary of the MESS project. And therefore, in terms of equipment, I am impressed by the level of equipment, and you know, I was taken round. And I'm very impressed with the kind of equipment you have, X-ray machines, and so on. What we need to do, of course, and we have agreed to do this with the governor, is connect this hospital on a fiber cable, a fiber optic cable, so that we are able to predicate use of the machines even by people who are not necessarily within the hospital. We know that there is a shortage of radiographers across the country, but we have also got technology that we can be able to use so that the interpretation of the data is done elsewhere outside this hospital. And we have agreed that that is the way to go. On the question of Alan, on the issue of the protocols that are going to be issued by the World Health Organization, let me make it clear that by the time somebody is going to be allowed to go home, that person will not be able to transmit the disease. The viral load will be low enough for that not to happen. But I'm going to ask Dr. Kuria to talk a little bit about that issue. Sarafina, on the issue of reports of mutation, again, I'm going to ask Dr. Kuria to respond to how they are mutating, particularly in children, and different countries experiencing different things. On the issue of the guidelines, that's one of the reasons why we are here. We are here to make sure that we are working with the county governments to make sure that the things that we have said, the proposals we have made, you have heard Governor Kimemia talk about the 300 beds, because we are supporting counties financially to ensure that counties have a minimum of 300 beds. There are some counties that need more beds than that. Nairobi needs about 3,000 beds. Mombasa needs about 1,000 beds. But so far, this county, we need about 300 beds at a minimum level. And we must remember, these are not hospital beds. These are isolation beds, so that we are able to keep people who are positive in well-placed areas where they can't be able to infect other people. Let me first ask Dr. Kuria to respond to one of the things that you asked. Dr.
Thank you, sir. Indeed, let me also say I'm more than grateful for this opportunity to be here today, and record also that I'm also not new to Nyandarua. I started my career here in this same hospital. I did my first Syrian section as a medical officer in theater here back in 1994. On the issue of asymptomatic carriers and the ability of asymptomatic positive COVID-19 positive individuals transmitting the virus, I think there was a report or a statement issued from the WHO that once stated that the issue of asymptomatic positives shedding the virus is very rare. And you will recall that the following day, that statement was pulled down. It was reversed, so we urge you to continue with what we had always advised. And we have seen very many asymptomatic positives even in our community, and others turning positive in their midst. So the possibility of asymptomatic positives shedding the virus to others is still live. And so the use of the mask, what CS has stressed, and we keep stressing, and I can see some of us are not wearing the masks in our midst. And we keep saying, if you see someone not wearing a mask, mwambie akuondokee tafadhali. So if you are not wearing your mask, please protect us. So asymptomatic positives can still shed the virus. We maintain that, and we maintain our masks. The issue of mutations, yes, they have been recorded in very many, and WHO has recorded a series of this. You asked whether we have any of recorded these in the country, and yes, we are in the process of conducting a research. It's being done one of our labs in Kirifi, And there are some preliminary results that are showing, yes, there could be some mutations, but the report will be out once it is validated from other chemistry labs, and you get this in due course. On the issue of home-based care and the protocols being issued by WHO, we as a ministry have issued our home-based care guidelines. And there are criteria we use to allow you to be isolated at home. And if you go to our website, www.health.go.ke, those guidelines are already there. You can go through them, read them, and you see the criteria under which we are allowing people to quarantine at home. Upon discharge from quarantine, there is a requirement, or there used to be a requirement that you are tested again. Again, we are in the process of reviewing our testing strategies, and WHO also is recommending that if you are asymptomatic at day 14 of follow-up, that second test may not be necessary. But we are in the process of reviewing this with our case management experts, so that you don't want to say that you don't want to go through a second test, but this will be confirmed in due course. But for those who have no symptoms and they have a place that you can stay and be able to isolate yourself, and on condition that you have someone who can take care of you, and that person has adequate PPE to protect him or herself, then a healthcare worker will assess your home and you'll be allowed to isolate yourself at home. This is going to help us in offload our healthcare facilities, which will soon get overloaded. So we are urging all of us to start preparing, of course, for those being able to care for your loved ones at home, and familiarize yourself with those guidelines as we go along. Thank you.
Asanteni sana.
Just one, mwisho kabisa. Just the last question.
Thank you so much. My name is Ngana Bridget from Nation NTV. I had questions for Waziri. We are talking about empowering these health facilities with the necessary PPEs, but also at the beginning of this pandemic, you mentioned that the government was embarking on an ambitious program to also improve on the human resource of the nurses. I don't know what is the status report for that at the moment, because we're talking about the isolation facilities being overwhelmed, but we're also not addressing the issue of the human capacity, if we have at all improved on the current statistics. And then, when you gave the breakdown today, you failed to maybe give us the distribution of the cases. And also, one of the counties that is Nakuru is a vector for transmission of COVID because of the truck drivers. How are we also improving the surveillance at the county level of these truck drivers as much as you have improved the capacity at the border points?
Thank you very much indeed. Let me respond to the question. First and foremost, the human resource. The way we are improving the human resource is training. There are two things. First, training. Secondly, hiring. Those are the main ways. And I have, during my walk around the hospital, I did keep on asking whether they are being trained, whether, for example, in the new isolation facility, there is training going on. And I'm assured by the chief, who is standing right in front of me, that that is going on. And we are glad that is happening. Secondly, even the contracts with the mess supply of the mess machines, one of the stipulations within the contract is that they will train people in the use of those machines, and they will maintain them so that at no time do they have lag time. On the issue of, on the human resource, essentially is training. And you know, we are also adding support, not just at the higher level, but even at the lower levels. There is a hiring of 5,000 health workers going on as we speak. And counties are different levels of that exercise. And I know that here, I don't know, Governor, whether yours have been hired or you're in the process of hiring, but we are hiring more people. That's essentially the point. We have hired already, that's good. Then, the distribution, I'll give you the distribution. No point of explaining Nairobi and everything, but we have got the distribution here with us. But the important thing here to note is that originally when this COVID-19 was announced, it appeared to be like a national government issue. Now, we have come down to say, this is not a government issue. This is an individual person's issue. We are in the counties to ensure that the counties themselves, you know, we work together in health. The Constitution in Schedule 4 devolved certain aspects of health, and therefore, the national and county governments have to work together to see that this is done. But the most important work for both the county governments and the national government is to educate our people and to tell our people that this disease is owned by each one of us, because it is at the individual level that we will be able to protect ourselves. The county government can provide all the things that we are saying. They'll do the hospital, they'll do the isolation facilities, but as you can see in Nyandarua, you know, so far so good. So we hope that those isolation facilities stay that way without anybody in them. It's just that it is best to prepare rather than get caught with our pants down, so to speak. So I want to stop there and once again thank the people of Nyandarua. Everything good has to come to an end at some point, and I want to say that we will be back. Tutarudi.
Asante. Asante.
Alafu sasa ningetaka, I wanted to make a presentation. Just give me one of them. Well, come, you are the ones who are receiving it. Me, I'll give it to the governor, then they give it to you. These are the PPEs we are talking about from the government. And we are very proud that these PPEs are locally produced and they are better than the imported PPEs. Asanteni sana, asanteni sana. Adwanyada ni modu manake hivi. Kage hivi yeo. Dumuge hivi ye. Yadwanyere demaga hivi ye. Asanteni sana, Gayaro Muradhima. Mungu ambariki.
This is NTV.